Public health is one of the most crucial aspects of societal wellness when it comes to serving the citizens of one of the most highly populated cities in the nation. Public health affects residents of the county on a daily basis. Anything from food safety to disease control are critical in the sustenance of healthy individuals in Los Angeles. Many aspects of people's personal lives, such as one's mental health, can be affected by the interactions in such a highly mediated city. Research shows that 1 in every 6 Americans get sick, 128,000 are hospitalized, and 3,000 die of foodborne diseases. Foodborne illness outbreaks increased greatly over the past years due to either salmonella or single food categories like chicken, mollusks, dairy, and fish. The cause of these outbreaks can often be traced back to unpasteurized products. One of the most common foodborne infections is E. coli, which can be transmitted through undercooked or raw hamburgers, salami, produce, and contaminated well water or surface water, frequented by animals, to name a few. Symptoms include nausea, severe abdominal cramps, and/or fatigue. A few simple ways to prevent E. coli infections are by washing your hands after handling animals and using the restroom, washing fruits and vegetables thoroughly before eating them, only eating perfectly cooked meats, and last but not least, avoid drinking unpasteurized liquid. Physical health, although mainly seen as a personal maintenance issue, plays a big role in the everyday statistics of Los Angeles. Drug abuse as well as alcohol poisoning is the 4th leading cause of premature death in Los Angeles. Between 2000 and 2009, there were 8,265 deaths in the Los Angeles area, and of those, 65% were due to the abuse of prescription drugs. Another important aspect when it comes to youth and physical health in LA is the education of health to students. Some time ago, health classes were widely available to students to help pave the path for a healthy lifestyle with the teachings of diet, exercise, hygiene, etc. It's important for students to realize that a healthy lifestyle is not a one-time thing. This type of education may help to lessen the number of overweight children and help prevent future medical problems such as coronary heart disease, cancer, and/or a stroke. One of the reasons diseases are transmitted is the lack of vaccination. H1N1, a seasonal flu, has a vaccine that is used through LA. All processes used in manufacturing the vaccine must comply with standards set for good manufacturing practices. The goal of these standards is to ensure that no cross-contamination occurs. Additionally, the vaccine must be inspected and deemed safe for use. Multiple diseases can be prevented with a simple vaccine. After being packaged in either bottles or syringes, the package must be labeled with the substance, source, destination, and identification numbers in order to meet strict guidelines, all which ensure LA safety. In Los Angeles from 2014 to 2015, crime rates went up by 10.7% and homicide rose by 8.8%. These numbers affect the residents of Los Angeles on a daily basis. Other serious crimes such as rape, which increased by 9.1%, robbery, which increased by 12.5%, and aggravated assault, which increased by a whole 27%, also play a significant role in the health of the people in the Los Angeles County. The city of Los Angeles plays an important role when it comes to the mental state of its residents. Here to tell us more about this is social worker Lillian Cativo, who works for the Los Angeles County Department of Mental Health.
City living can be a lot of fun, and I think that's what draws people to city living. However, city living can also impact someone's mental health in a number of ways for different factors. Research shows that some of those factors can include unemployment or underemployment, cost of living, low wages, soaring rates. Sitting in traffic for hours on a daily basis can increase someone's stress level. According to the National Institute of Mental Health, depression is the most prevalent mental disorder among Angelenos. Other stress-related disorders can include anxiety, some psychotic disorders, which can include schizophrenia as well. Mental illness among homeless individuals is soaring. Lots of trauma, depression, and diagnoses like schizophrenia or other psychotic disorders are prevalent among not just homeless individuals, but also homeless youth. 90% of individuals who end up committing suicide suffer from some mental illness. The most common is depression. You can go to the National Alliance of Mental Illness website for additional information for those who may be in more immediate need. You can call hotlines. There's suicide prevention hotlines. There are hotlines for teens. There's warm lines for those who just need somebody to talk to. There's help available. So at the end of this program, you will see a list of resources that might be helpful.
Our goal here at the Los Angeles Museum of Public Health, or LAMP, is to educate the public on the well-being of those living in LA. Whether it be physical health, mental health, or safety, LAMP wants to help others realize that public health of the county affects residents on a daily basis. Taking care of yourself means taking care of the city. Here at LAMP, we have your best interests at heart. The question is, do you?